Hi everyone, it's Andrea. I want to talk to you today about fibroids. Could fibroids be causing you heavy bleeding? If anyone doesn't know me, I'm Andrea. I like to help and support women get healthy hormones so they can get on with their life and look good and feel good inside and out. And I'm the author of my book, the Peri Menopause Handbook. Let me know if you'd like a copy of my book. Fibroids. Are you a woman who's suffering with some fibroids and heavy bleeding right now? So stick around because I'm talking about what they are and how they can get out of control. So fibroids are, they grow in your uterus and they grow in the muscles of your uterus. So if you think about it, your muscles, they have uterus has muscle tissue and it has fibrous tissue, and the muscles in your uterus act just like all the muscles around your body. They need to contract, they need to relax, and they can stretch. So we think about it in your pregnancy. When you get pregnant, uterus stretches for the growth of the pregnancy, and then when you want to when you give birth, your muscles will contract to expel the baby. Fibroids develop when the particles in of fibrous tissue starts to grow in your muscle tissue, and it'll start to grow over quite a number of years. It can come through your 20s and your 30s. As you're having your periods, you will have the first 2 weeks of your period, you will have that estrogen dominant part, and then the second 2 weeks you have the progesterone dominant part. So when your estrogen's high, this is when your fibroids can start to grow, and they will grow over your 20s and your 30s over quite a number of years. And I would say around 30 to 40% of women can have fibroids that are causing them lots and lots of problems. And lots of women can have fibroids that don't grow much at all. They're very small and don't cause any problems. So you could have multiple fibroids growth as well. You can have fibroids that are just growing all around your uterus. They can grow on the outside, on the inside, and some of them can grow bigger than others as well. And it can cause your uterus to go a bit out of shape and a bit disjointed. And they can cause the heavy bleeding. And the way that they cause the heavy bleeding is because when your uterus is contracting, because of all the fibroids that are there in the way, your uterus can't contract properly to control the bleeding, and this is where you can have the heavy bleeding that can go out of control. And the heavy bleeding can go on for quite a number of weeks, and it could go on for months. It's just quite unpleasant. It can be a big disruption in someone's life, in a lady's life. So you want to try and avoid that. And your fibroids are not cancerous. They're just benign. They're just benign growths in your uterus. There's nothing to worry about there. So the bigger they are, the more that they can cause problems, and you can have pain as well, pelvic pain, or you can have pelvic pressure because of your fibroids if they can grow really big. And like you say, they do grow in your 20s and 30s, and they can grow over a number of years. And then when you hit perimenopause in your 40s, this is when you can start seeing a lot of problems happening. You can start seeing a lot of more heavy bleeding, a lot of problems because of the estrogen dominance, and your periods are just all over the place. Some months you might ovulate, some months you won't ovulate. Some months you do ovulate, some months you don't ovulate. So when you don't ovulate, you don't produce progesterone. So this can cause more estrogen dominance and low progesterone levels. Your stress levels can play a big part as well with estrogen dominance and low progesterone, because your body will steal progesterone to cope with stress levels. You might have some estrogen metabolism problems, so that's the buildup of estrogens can happen that way. You may have your lifestyle comes into play here as well. some lifestyle factors like toxins. You can get toxic estrogens from like called xenoestrogens that are in your toiletries, in your household products, toxins in the air fresheners, things like that, are xenoestrogens. They mimic the estrogen in your body, and they can take over your hormone receptors that interfere with your normal progesterone, normal estrogen, sorry. Yeah, so all these can come into play. So diet and lifestyle factors can play a really big part in the growth of your fibroids and not keeping them under control. And in perimenopause, when you're having lots of heavy bleeding because of your fibroids, it can be very, very unpleasant. So what happens then in menopause when what happens to your fibroids then? A lot of people think that they do shrink in menopause, but I don't think that they do shrink. I have really studied this and looked into it a lot more because I thought that they might do, but I don't think they do. I think that they just stop growing and they stop causing lots of problems. They can stop causing the pain and the bleeding because your periods stop in menopause, and your hormone levels are just at a very low level. Your hormones decline to a low level. But you probably could still get some pelvic pressure because of, depending on what size of fibroids that you have. If you're aware that you have large fibroids or lots of causing problems, you've probably been to your doctor already, and they're monitoring the size of your fibroids and the growth of your fibroids. So it's really important to get them checked out and keep the growth under control. If they're growing out of control and causing lots and lots of bleeding, you're at risk then of iron deficiency and anemia. So it's important that you get some options from your doctor. If you're thinking about getting an embolization, which can shrink fibroids, or maybe thinking about a myomectomy to take them out, that are the ones that are causing you problems. But there are lots of other things you can do to help the growth of the fibroids so they're not getting too big. Lots of diet and lifestyle factors that you can consider, and this is where I can help you out. If you want some diet, you want me to look at your diet and your lifestyle and some issues there, I can look at it for you and identify what's causing all the problems. You can do a lot with your diet and your lifestyle to alleviate some of the symptoms and stop them from growing so much. So I'll put the link below if you want to have a call with me. I'm happy to have a chat with you over a coffee, and we can have a chat what your issues are. So I hope that's answered a lot of your questions about what fibroids are and how they can cause heavy bleeding. Heavy bleeding can be caused in lots of other different ways as well, not just fibroids. But fibroids is just one of the things that can be causing heavy bleeding. So thanks for watching my video today, and I'll see you again soon. So take care. See you later.